Hi everyone and welcome to today's edition of FlashlightMedics, the online medical education portal designed to help you learn your medical studies in a flash. Today we're going to have a look at how to interpret chest x-rays. Interpreting x-rays is a fundamental aspect of being a junior doctor, and it's something you should learn as a medical student. It will not only help you become that amazing junior doctor, but also you'll be able to excel in your exams. The best way to learn how to interpret x-rays is by starting off with the anatomy, and today we're going to focus on the anatomy of a chest x-ray. So let's begin. The first aspect of a chest x-ray that we need to consider is the trachea. The trachea is located on the upper part of an x-ray, and it's located above the thoracic inlet. You can often tell the trachea is there because there is this shadow which is located right in the centre, which is the presence of air as it appears on a radiographic film. You can also tell that the trachea is there because there are the presence of the spinous processes of the vertebra located behind the trachea. This structure will then meet the bronchial arch and subdivide into the left and the right main bronchi. Now, it's important to consider that the right main bronchi is slightly more vertical and higher compared to the left. So why is that important? Well, it's important because in cases of a foreign body ingestion, the foreign body is much more likely to enter the right main bronchus as opposed to the left, and that's where you'll find your foreign body, and eventually you might have a lobar collapse. The next structures to consider would be the lungs. As you can see on the x-rays, the lungs are located within the regions that are highlighted, and you can often map them because they are continuous with the chest wall with a pleura in between. The right lung is made up of the upper, middle and lower lobe, and the left lung is made up of the upper and the lower lobe. Within the lungs you can identify lots of vascular structures. So here we have the hilar, which are located on either side of the heart, and they're made up of both bronchioles and also pulmonary vessels. The bronchioles are identified because they look like the branches of a tree and are located on either side of the heart. You might be able to isolate individual bronchioles because they look like a circular structure. Imagine if you had a pipe and you cut it in half and you looked end on at the edges of the pipe. You might see a circular rim to the structure. That's exactly what a bronchiole looks like, and it may be highlighted even further in cases of consolidation such as you would get with a chest x-ray. This region here is referred to as a bronchogram. The next structure to consider is of course the heart. The heart is located in the centre of the thoracic cavity and it appears as a globular structure. There are two important diameters to consider when looking at the heart. One is the cardiac diameter, which is located as a horizontal line extending from the left to the right margins of the heart. This diameter is called the cardiothoracic diameter, and it extends between the centre of the thoracic cavity to the chest wall. The significance of this is that you can estimate the size of the heart and its proportion to the thoracic cavity based on these two diameters, but we'll address that in a bit more detail when it comes to interpreting the chest x-ray. The cardiophrenic angles are important angles which are used to interpret the chest x-ray. They're located at the point where the margin of the heart meets with the border of the diaphragm. You can identify both cardiothoracic margins on either side of the heart, and their normal appearance is that they should be sharp. Very similarly, we should have the costophrenic angles, which are located where the pleural border lining the chest or cavity meets with the border of the diaphragm. Again, these angles should be quite sharp and well defined. You should be able to fit the shape of a V in between either side. Again, the significance of these angles will come into play in our next video on interpreting a chest x-ray. The next important aspect of the chest x-ray anatomy would involve the skeletal system. It's important to note the anterior ribs on a chest x-ray, and they curve moving downwards towards the centre of the chest. Usually you should find between 5 to 7 anterior ribs, and you can often identify them by counting them across the chest x-ray. There are also posterior ribs which have a different orientation, and they also curve downwards, outwards from the thoracic cavity. It's very important to note that there are 12 posterior ribs, and you might need to be able to highlight and count them during the exam. We then look at the clavicles, which are also linear structures located on either side of the vertebra on the upper part of the chest wall. The clavicles will then eventually go on to meet the bones making up the shoulder joint. Finally, we're looking at the vertebra, which is located right across the center of the thoracic cavity. You can identify the vertebra because of the presence of spinous processes. These are the nodule-like structures which are located and very prominent, located across the center of the thoracic cavity, moving down in a linear fashion. You have your cervical, lumbar and thoracic vertebra, and it's important to identify these on a chest x-ray. So there you have it, that's the anatomy of the chest x-ray. Thanks for watching this video, and subscribe to our portal in order to have a look at how to interpret chest x-rays as well as abdominal x-rays. I hope to see you next time on our videos. Thanks again, see you later from the FlashlightMedics team.